I'm going to pick up both hands for inspection. This has to be done quite gently because obviously some of these patients will have a fair bit of pain. As you can see, that he has some swelling in most of the proximal interphalangeal joints in both hands. As well, there's swelling in the metacarpophalangeal joint on both hands on the third MCP. Notice that there's a little mallet deformity in the little finger from previous injury. Now, I don't see any deformities such as subluxation over the metacarpophalangeal joint or ulnar deviation. Now, looking at the nail beds, which is very important, I don't see any evidence of dystrophic changes or lifting, so-called onycholysis, which one may see in psoriasis, as well as pitting, which is also seen in psoriasis, over the nail bed. There is no periungual erythema. Sometimes you see redness around the nail edges, or splinter hemorrhages, or any nail fold infarct, which would appear to be a darkened, infarcted area.
Right.
Now, turning his hand over, looking at the palmar surface, I don't see any wasting of the hand muscles. I'm going to ask him to move his joints. I'm going to first ask him to move the proximal interphalangeal joint and look at the range. Will you please move your? As you can see, on passive flexion, there's a fair bit of restriction of the PIP joints.
I should be able to get it really into the base of the.
Yes, he should be able to get to right to the base of the palm. And I'm going to ask him to move his metacarpophalangeal joint right up.
Right.
And you can see that there's some mild restriction as well.
Right.
If I were to push him down further, he would have pain, and this would be stress pain.
Right.
And the patient is not very pleasant. Oh, I'm sorry.
No.
Now, at the same time, I think I'll ask him to make a fist, and a hard fist. That's a reasonable fist, but actually it's probably not so reasonable. I'm going to ask him to grip my hand. Please grip my hand. And by and large, it's quite a weak grip.
Right. Right. Okay, now where do you move now?
I'm just going to palpate these joint swelling,
Right.
or the proximal interphalangeal joint swelling.
Now you're palpating that for what reason?
Now I'm just going to detect if there's fluid present within the joint.
Right.
I'm going to use this technique, which is called a four-finger technique, using 4 fingers, my thumb, and my index finger, holding this proximal interphalangeal joint very firmly, even though when the patient has arthritis, there isn't any pain. I'm going to use my right hand and to palpate the bogginess on this side. You can see that there's...
So what you're doing is you're putting the joint under tension with your thumb and index finger of your left hand.
Yes.
And then you're palpating, squeezing with the other 2 fingers. And normally they wouldn't be indent at all.
That's exactly right.
Are you picking up synovial thickening there, or fluid, or both?
I'm picking up both synovial thickening and fluid.
Right.